The technology behind the treatment has changed so drastically in the last 20-some years that I've been doing this, that it's gone from what we used to call a 4-field box setup. You treated from the front, the back, the left, and the right. And because we didn't really have the technology back then to see internally and to make sure that everything was exactly where it belonged and make the adjustments necessary, the doctors had to actually define an area that was going to be treated that was actually larger than what had to be. But there was no way to fine-tune it back then. So to make sure that that floating gland didn't move out of the treatment field, the treatment volume was a lot larger. And years ago, yes, there were a lot of complications with possibly a loose stool, bladder issues, a lot of different things used to crop up. But it was because we were having to treat such a large volume to make sure that we got what we needed. Now, with the technology that we have, we're able to pinpoint within a millimeter of where we need to be. Instead of having to draw an area that's 3 or 4 inches wide around the outside of the treatment area, now we're down to ½ centimeter. And that's a huge jump, because 2½ centimeters is 1 inch, and we're down to ½ centimeter. So we're really able to focus in and get exactly where we need. There are a lot of treatment machines that are utilized for treating all different parts of the bodies, and actually the machine we have could be used on a lot of other areas. We focus on prostate here at the Prostate Cancer Institute. Big difference with our machine versus the other ones in the area is we can treat as the machine is rotating. It's called a rapid arc. As the machine rotates around the patient, it's delivering the treatment constantly. In 2½ minutes, we can deliver the same amount of radiation as most other facilities take 10, 12, 14 minutes. That doesn't sound like it's a whole lot of time, but when you consider the fact that a man has to come in and lay down on the table and he has a full bladder, and you're telling him he has to hold still long enough to take x-rays or whatever mode they use to localize, and then he's going to lay on the table another 20 minutes before everything is done and they get him down. In 5 minutes, I've got the patient off of the table, and we don't have the accidents, if you will, because of the full bladder issues. It's hard to hang on to your water that long.